We've been working with GSK and us in Lupus for several years now. And in the past couple of years, they've supported us in big ways. They have sponsored all of our education programs and all of our walks. And we are so grateful to partner with them. And we'd like you to take a moment when you get a chance to go to www.usinlupus.com and check out some of the resources that they have. So we need to thank so many people. Like I said, Dr. Lim, other doctors who have presented programs for us. We have been able to get through this year without skipping a beat because of the service, the contributions, the generosity, and the goodwill of the lupus community and our supporters. I want to talk to you about a little girl named Marie, pictured here. Marie is 7 years old right now, and she has spent a good deal of time in Children's Hospital. She has lupus nephritis, and she lived in Macon. So she was coming back and forth after she got out of the hospital every week to get Cytoxin, chemotherapy for her lupus. And her parents wanted to move up here to Atlanta. And we were able to facilitate that through our emergency financial assistance. We were able to help them out. And they have moved up to Atlanta now. And not only that, but they've been able to connect with other parents of children living with lupus through our Lupus Parent Project. And Marie has actually been able to connect with a little 8-year-old girl who has lupus. So we look at this as a holistic view of the person living with lupus. We support that person, we support their family, we support the community around them. And we, like I said, we couldn't do this without the support of so many people. So I want to thank our advocacy team. We've got Alita McLean and Chris Reed on the call tonight. And they have been so helpful in facilitating this series. And they will actually be moderating parts 2 and 3 of the series. So we're really grateful to them. I'm grateful to our board of directors who have provided support, guidance, and just servant leadership through this pandemic. And we can't wait for doors to open up and for us all to get together so that we can all meet again. But I really have to thank the boots on the ground. These are our support group leaders. These are our volunteers and our advocates. These are the people that go out to the health fairs. They're the ones who take the phone calls, who connect patients to us for resources and provide resources themselves. These are knowledgeable, our support group leaders are a knowledgeable group of trained advocates who really know how to navigate their way around the lupus world. And we're grateful for everything that we do. They're part of a community, and it's a community strong. And we, our goal this year, taking lupus from a whisper to a shout, of course. But this year we want to make lupus visible. It's always called an invisible disease. It's not an invisible disease. We need to make it more visible, and we need to work towards that goal.
Chair recognizes Representative Schofield for a morning order.
All right. Just trying to get them all up here. Thank you, Mr. Speaker and members of the House. Each year, I stand before you to recognize Lupus Advocacy Day. Each year, the House and Senate stand together to publicly support and acknowledge over 55,000 Georgians living with or impacted by lupus. I am very thankful and appreciative of my colleagues. This year, our event will be held virtually at 7 p.m. tonight, but we as members of the Georgia General Assembly have a House Senate resolution, governor's proclamation, and we wear our lupus capes in solidarity of the strength that it takes to live with lupus. Our work continues. Mr. Speaker, this flood of purple yields the well.
So that's what happened this morning down at the Georgia State Capitol. And we are so grateful to Kim Schofield for leading this sea of purple each year down at the Capitol, wearing our purple capes. And it's just an awesome experience. And we can't wait to be back there again next year. So tonight we are going to present a town hall as a first segment in our series. And we are grateful to have Bonnie Rich, Representative Bonnie Rich, and Representative Kim Schofield with us tonight. Bonnie Rich is a graduate of the honors program at the University of Georgia. She got her Juris Doctorate from Georgia State University in 1994. And she's on the board of directors of the Sage School and the Georgia SPCA. Bonnie comes to us because she has a connection to lupus. Her sister has lupus, and she has shared that with us. She's joined our Georgia Council on Lupus Education and Awareness Collaborative as part of the Patient Outreach Committee to see how we can spread awareness across the state and how we can provide support, and in her case, support to families. So we're grateful to have Bonnie with us tonight. We also have Kim Schofield, and many of you know Kim. Kim is Kim, when I was setting up my introduction, I said, I don't know how long you've been a part of the Lupus Foundation. It's been since I've been there in 2007, and I know it went further back than that. But when I came on, you were starting Advocacy Committee, and you were just an unbelievable advocate for people living with lupus. And you took that from a personal cause to a professional cause as a representative. And we're grateful to have you on the line tonight. So I would like to have each one of you, Bonnie, you can go first, just talk a little bit about yourself, tell us a little bit, and then we've got some questions for y'all.
All right, thank you all so much for having me here, for inviting me. I am relatively new to the House of Representatives. I've just started my second term, so it's my third session since our terms are 2 years each. And I come here kind of, I guess, late in my career. I've built a career, I've reared my children, and I felt like this was time for me to start giving back, since I've kind of taken care of my family for all these years. And I wanted to come to the Capitol and work on things that really matter to the people of Georgia. And I have some life experiences that have shaped the agenda, I guess, for what I want to work on. And I was so excited to meet Representative Schofield and to learn about her advocacy for lupus, because it's something that lupus has been a part of my life, really for most of my life. My sister was diagnosed when she was 17, and I was 19 years old. And I'm now 51, and so she's 49. And she's been really sick with lupus for her whole life. And she's taken prednisone for all of these 30 years. So that brings on its own set of issues. But those of you who know, who have, maybe you're sick yourself, a lot of you are, and whenever there's a chronic illness in the family, it affects everyone. And I think it's made us more compassionate. And I just kind of know firsthand some of the issues that we've experienced as the family, and her son has experienced. And I really want to be able to make things better, or help with resources, whatever we can do at a legislative level. And Terry had given us a list of some issues, and I thought, wow, there's a lot more I can be doing and working on. And it's kind of inspired me, Terry. I really am kind of excited about some of these issues. And if everybody is, willing to get behind something, then y'all can count on me to help lead the charge.
Bonnie, thank you for stepping up, and you're a breath of fresh air. And thank you. We appreciate you, and thank you for joining us tonight. So next we have Miss Kim Schofield.
Good evening, family. Thank you to the Lupus Foundation. Thank you, Terry, and everyone on this phone. Thank you to my colleagues, Representative Bonnie Rich. We also have Representative Chris Irwin, Representative Shay Roberts, and Senator Tanya Anderson, who serves on the board of the Georgia Council on Lupus Education and Awareness, GCLEA. Terry, you're right. This has been a long journey. I had lupus in 2000. I was diagnosed and came to the chapter through Rosemary Graham, and been working with the chapter and have seen the great work that we continue to do. Stand shoulder to shoulder with Betty McPherson and Alita McLean. Have my support team has always been Thomas Walters and Chris Reed. And so, and you, and all of the ones that have been on the phone have been an extended family that keep us alive. My life would not be where it is, and I would not be who I am becoming if it wasn't for the Lupus Foundation, the work that we do in lupus, and the phenomenal Dr. Sam Lim, who will always say, no, it's not me, but had it not been Dr. Lim, I would not be still alive, and I would not be doing the things that I have been able to do. And so, you know, I appreciate everybody on the phone. I just want to jump in and just share, you know, you say you showed this clip this morning, but prior to just actually doing the morning order for weeks, legislators have been coming to me and saying, hey, when are we going to wear our capes? When is Lupus Awareness Day? So, you know, the power of presence, making lupus visible, has been something we've worked with for years. And I tell you that the fruit of our labor pays off. Let me just show you a couple of photos today that we took. I'm going to share my screen, Terry.
Okay.
And,
Go ahead.
Okay, just a couple of ones. Today was just an amazing day. So that was the group picture that we took today of everybody coming down. They were coming from the gallery since we're all separated now. And so everybody was trying to get down there for the photos. We had pictures today. These were new legislators, old legislators. Everybody was in their space today. It was just so funny and amazing. We were pretending we had to tell them that the capes aren't real, so don't fly off the balcony. This was the photographer that wanted to be a part of it. Ben was so excited to be representing lupus today. And this is how we ended the day, that our presence is always felt in the chamber on both sides. Senator Anderson had the Senate side. I'm going to stop sharing my screen. Had the Senate side, took pictures and everything. So today was an amazing day. Although you were not physically present, your presence was felt in the chamber today. The Speaker of the House said to me, he's going to wear a cape next year. So just wanted to welcome and thank everyone for having me here today.
Well, Kim, thank you. Thank you for what you do. And thank you for, it was so exciting to see that this morning, to get up and see that this morning. And I was sharing with Bonnie before we got the call started, with our social media, you know, we can tell how many clicks we get in a day. We got almost 5 times as many clicks on our social media today than on a normal day. So, you know, we know what people want. They want to advocate, and they want change. They want change. We need forward movement. And I think that's why advocacy is so darn important. You know, you can't underestimate the value of our advocates and going down there and having you guys fighting for us. I talked to Dorothy Leone Glazier last night, and she said the struggle of the pandemic has been not having those heads in the Capitol, having people there, having the advocates going there and telling their stories and why it's important to them. So we're grateful for you carrying this torch for the lupus community so that we can move forward and look towards years ahead. But thank you so much for what you do. So I'm going to start off with a couple of questions. I'm just going to let you guys just bounce them back and forth and answer them. So I sent them to you earlier, but I just wanted to get your feedback on them. So the first thing was, what's being done in the area of public health to advance health initiatives that would benefit people with lupus?
I can say not enough.
There you go.
You know, the one thing that stands out to me, and this is something that I think we started last year or the year before, is the telemedicine. My sister has used that so much. She lives in an area where I think GoMed is who she uses. And they come to her home, and it's just helped her to get care. Sometimes she's not quite strong enough to even drive to the doctor. And oftentimes we're really concerned about, of course, her lack of immunity. So they've expanded that this year to allow physicians to actually conduct telemedicine from their own homes now in light of the pandemic. So, and when I was looking through it, Representative Schofield, that was really the only thing that I saw that happened this year that seems to touch on lupus patients.
Right. And so 2 years ago, we did a pilot through GCLEA down in Dougherty County that was a telemedicine, telehealth pilot that was spearheaded by the wonderful Chris Reed. And we assessed, the timing and other areas, and Dr. Lim was on that as well. We assessed the areas and the gaps when it came to telehealth and telemedicine. And so as we put up our rural health caucus, as well as we're starting to do some things in telemedicine, Bonnie, you and I will work on how we get more funding and to expand that, to really look at possibly going into another county so that we can really start moving lupus across the state and looking at the actual numbers. We have done some great work through the registry and through the foundation with educational programs, but now it's time to put our money where our mouth is. You know how that goes. Also, Pedro Marin, which I just found this out, HB 738 authorizes the production of medical marijuana in the state to be used for the following diseases like MS, sickle cell, fibromyalgia, Alzheimer's, and he told me today lupus is added on that as well. I also know that we'll be putting up some legislation to include the lupus on the low THC oil in that registry. So there are some things that we'll be doing in support of patient advocacy, patient improvement in quality of life. I'm working on some workplace accommodations, the stay at health, return to work, so that there are provisions made when people have lupus outside of just what the Department of Labor and EEOC and others requiring. So it's a fully functional thing, and I'm glad to have my colleagues on board. Senator Anderson has joined the GCLEA board as well, and so if you get to speak it, to move a little faster, Bonnie. It's been 3 years now.
Why isn't, I feel like I'm a part, I feel like it's been overlooked. I might give him send him a message.
Nudge the speaker, but and so Representative Senator Anderson may want to say a few words, which her helping us getting some appropriation. So we're working across the aisles, and you're going to see a lot of, how it is up under the gold dome. You've got to work incrementally to get things done. But so with our appropriation money, we're able to do more, but now we've got to push the needle a little farther.
There you go. Well, thank you for all the good work that you're doing and the work that's being done through the Georgia Council on Lupus Education and Awareness. I think this is, there's some great opportunities to branch out into other programs. And I'm glad that the Lupus Foundation of America Georgia chapter is going to be part of those initiatives, and how we can help, and how, like you say, we can, we're educating people, we're getting the word out, we're raising awareness, and now let's move the needle. Let's move the needle and working together on this. And we're grateful for all of these opportunities. So I've got the next question, and I think, did you? Kim.
Senator Anderson said she'd like to say something. If you
go ahead. Absolutely.
Well, first of all, thank you for having me. I'm excited about the great things that are happening with lupus, and I still have on my purple. I changed into something a little more comfortable for home, but I am not moving away from my purple for today. I have a cousin in Florida who has lupus. I first learned about lupus from a college roommate, or classmate, I should say. And so the education of this and the advocacy of this has been something that I am proud to do, and I am honored to serve on the council. I want to say to Representative Kim Schofield that as long as I've known her, I think I just recently, as she came to the Capitol a few years ago, found out that she had lupus. And I have to say congratulations to her for always being a strong voice for lupus, and for making the day a day of education and advocacy at the Capitol. What people don't know is what they don't know, but when we teach them, when they learn, they become advocates too. And to hear that the speaker is excited about supporting it says that the needle is moving closer and closer in favor of lupus and funding for lupus and legislation for lupus. And so I want to say thank you. I want to say thank you for having me, but congratulations to you, Representative Schofield, for being a strong advocate to the point that, you know, you made educating others easy, and the advocacy comes along with that. So congratulations and thank you for today, for having me.
Well, thank you for being here tonight. Thank you for sharing. That is fantastic. And it is great to have somebody with your strength in the fight. So thank you for what you bring to the table. Thank you. On behalf of the lupus community, thank you, thank you, thank you. So that's all I can say. Should the next question, here we go. But I think this got answered actually by Dr. Mangu answered this last night. It was, what is the status of COVID vaccinations in general and the lupus population? And I think as of Monday, they're opening it up to people, immune compromised people, and they're lowering it down to 55. Am I missing? Is there something else going on? Did they change the status of any?
No. And again, you know that since this has started, whether it was the shortage of Plaquenil, hydroxychloroquine, or other problems, you know, I've always been working with the Department of Health to make sure lupus was getting the attention that it needed. You know, with the CDC guidelines, there was only so much I can do, but rest assured that anything that came out with the COVID pandemic, the disease, the work requirements, I was always at the forefront fighting and raising my voice to wonder, how does this impact the lupus community? I just had a conversation with Dr. Toomey about 2 weeks ago after Terry and I spoke, and she was saying, sit tight, we're gonna get to the lupus population. You know, we're always competing for so many different diseases.
Right.
But know that any chronic disease, especially lupus, is high priority for me in our world. And so when you see a public health crisis, know that there's no one just sitting on the sidelines waiting for things to happen. The Lupus Foundation, the docs are fighting, and we at the Capitol are fighting to make sure we get what we need. I see a question about fully expanding Medicaid. Well, I wish I had the magic wand that can do that. You know, that's been the cry of the Georgia General Assembly Democrats forever. We have resources that can prove we can fully fund Medicaid expansion. Unfortunately, it's just not something that the state is doing at this time. But we will continue the fight. And so I know it's hard. I know the struggle is real. That's why advocacy is so important, for you to tell your stories, tell your struggles, make us understand what it's like when you don't have the resources and access to things that you need.
Right. Okay, so it's great. And I want to make one statement concerning the vaccination, getting a vaccine. Just please make sure you check it out with your doctor. You know, we don't know, people with lupus take so many different medications, and you know, flare definition, what a flare is, how much prednisone you're on, whether you're taking high levels of Cytoxin. It's really a decision to be made between you and your doctor, whether or not. Where the ACR has come out with recommendations saying that it's safe for people with who have autoimmune diseases, please just check it out with your doctor and make sure that you get that okay. That's what's going to make everybody feel comfortable to do that. Just don't listen to anything you hear on the internet. Make sure this is part of that relationship with your doctor, and make sure you check that out. So I know I'm a broken record with that. People say, I say it all the time, but it really, that's the most sacred relationship, is that he or she knows what's going into your body, and you know how you're reacting to it. So just do that. So let's move on to the Family Care Act. Bonnie, maybe you could do this, a brief overview of what the Family Care Act is.
So the Family Care Act, it's relatively new. I think it was enacted 2 years before I took office. And it allows an individual to take unpaid leave from work in order to care for a sick family member. It applies only to employers who have more than 25 employees. And even some of those may be accepted, meaning not included in the act and not required to abide by it if they have a stock purchase plan for their employees. So, when I was reading through it, it looks like there was a lot of compromise there on, our side, the side of the people who need it. And, but that, Kim is exactly right. Just because we didn't get everything that we needed right then does not mean that the war is over. We won one battle, or we got our foot in the door. Next time we come back and we say, okay, this has been good, but it's still not meeting the needs that it needs to meet. And this is why. And one thing that you pointed out, Terry, in your question is there really is not an enforcement mechanism. So we just have to depend upon the employers to voluntarily abide by it. And, I used to be in-house counsel for a big corporation, and we really did try to abide by all the rules, but not all of them do. And I suspect also that a lot of smaller businesses don't really know about this and may not be complying with it. So I think a lot of people who need it may not even know about it. I think this is an area where we really can make a difference. One thing that we passed this session, and I was a co-sponsor of it, it was led by Representative Houston Gaines, is for paid leave for state employees who have a child or adopt a child. And it's a great way for us to kind of have the state lead by setting a good example. And maybe that could be a similar route that we could take with respect to the Family Care Act. We're always hesitant to place unfunded mandates on private employers with respect to the paid leave. But if the state of Georgia were to start doing that, we can lead by example. And when that happens, when a state does lead by example, some employers do follow because it kind of sets a new standard. So I think this might be an area where, we could work on something together.
That's a great point, Bonnie. So really, when you talk about enforcement and penalty provisions, a lot of it is because people don't know. What you're saying is there's not enough education out there, and a lot of people don't know it's available to them, and employers don't know the provisions and don't always understand it. And there's a lot of loopholes. It sounds like there's also a lot of loopholes in there. So it looks like you all have your work cut out for you with this. So thank you. That was a great answer. So we talked about Medicare. We talked about Medicaid expansion and what it would take. So here was a specific question to it though. Does Medicaid expansion bill that was signed in 2019 provide a mechanism for those who live below the poverty line to obtain Medicaid without meeting the requirement contained under the pre-2019 law? Does that make sense?
I'm not sure exactly. I understand that the Medicaid, we had a partial Medicaid expansion last year, which provided a waiver for people who are, I think, at maybe 138% of the federal poverty guidelines. Does that sound right, Kim? It's meant to include more, but it's not 100. It's not everyone.
Right, Kim, you're on mute. Sorry.
Yeah, it was 138%, right?
138% of the federal poverty guidelines. But it had a work requirement or a community or civic engagement. So if someone were in school, or I guess maybe actively involved in regular volunteering, or working at least, I think, 80 hours a month. Those were requirements. That has been called into question because of the pandemic. A lot of the people who need this have not been able to work because their jobs weren't available to them. So that's something that is being, I believe, re-examined. And I also understand that the partial waiver that we requested, we requested the full funding, the 90% funding from the federal government, but I think we were denied that. And if what I read is correct, it would cost us the same amount of money to fully to expand for a full Medicaid expansion as is what we're offering now, because we're only getting 67% of a match instead of 90%. So,
Right, but we do have the opportunity to get the 90%. So we say we do.
Yeah, and I will admit that healthcare and Medicaid, those are really complicated areas of the law, and that is not my practice area, and I'm not well versed in them. And I don't really understand the arguments, for and against. I, of course, understand the ones for. I mean, I understand the people who need it, but I don't fully understand the arguments against fully expanding Medicaid, especially given that reimbursement and the cost to the state. And it could be that those are just new developments in the last year when we were denied the full 90% reimbursement. Maybe that will cause the people who were working on this to take a different look at it. I think Jody Lott carried this legislation last year, or in 19. Is that right, Kim?
That's right. But
Now, why were we denied the 90%?
I think that they
Is that a loaded question?
I think
it is.
I think was it the work requirement?
It was the work requirement.
Yeah.
And it's just partisan politics, We really do have an opportunity, and to Bonnie and I think we agree that we have to do something because the healthcare system is broken. I think it's how we get to where we need to. It's the challenge. And so, some of the legislations that have been put up don't work for all. The waivers, now are being called into question because it isn't the best opportunity. And the state does have an opportunity to get this money. I don't understand if we can really afford to just say no and opt out of everything. I know as a person that was a part of the Affordable Care Act, it was a lifesaver to have that cushion, that safety net. And I think COVID exposed that we're really going to need to have things in place that would be able to help those that we got to do something about the federal poverty line. We also have to do something statewide to put in these safety nets. And again, I have my colleagues, Shay Roberts and Chris Irwin and Senator Anderson jump in here as well. We're gonna have to start putting. Too many people are suffering, and we saw this really. If we had some things in place during the pandemic, I think we would have had a different outcome.
Okay. So you mentioned we've got Representative Chris Irwin and Representative Shay Roberts on the call. Would they like to join in for a moment here?
Well, I see Shay's gone right now, but I know Chris was here. He may have jumped off.
And Representative Anderson.
Hello?
And Representative Tanya Anderson.
Okay. And Representative Tanya Anderson. So do we have them on the line?
Senator Anderson. Yeah.
And I'm still here.
Chris, are you here? You want to share a little bit about your how you are involved with lupus?
I will, Kim. Can you hear me?
Yes.
We do. Obviously, I'm involved with lupus through my wife, which has lupus, and in caregiving for her and taking care of her, and her experience, Kim, would be what I would share, and just the importance of first of all educating other family members that are involved and affected by this. And ultimately, that has made me very supportive of many of the measures that we're doing right now, and trying to continue my active role in trying to assist whatever measures we can to make the situation better for not only just my wife, but anybody who has lupus.
I so appreciate you. I remember we were sitting the year before last at a table, and I was sharing my things and about lupus, and lupus is very personal. And so later you and your wife shared your involvement with that. And it's so funny that being up under in the General Assembly, how many people didn't know and didn't know who to talk to. And then when they found out that I had it, just so many people like yourself, my colleagues that have come on board and trying to make this a better win for people impacted, family members, and educating the General Assembly, which is why I'll always go back to advocacy and people like Dorothy Leone Glasser that come down and are patient advocates and have worked with us through over the years, and all of the people on this phone that have come down there in the rain and in the snow and the cold to tell their stories, that now people under the Gold Dome know what lupus is. We're going to get better in educating them about what it does and how it impacts us. But because of your advocacy work and your voice, they know lupus under that Gold Dome. If nothing else, they know what purple means. On purpose, any other time, they'll say, "Oh, is it Lupus Day?" So you guys, I can't, our colleagues are being, and again, this is not a partisan issue. This is a health public crisis issue.
Right. And Representative Irwin, thank you so much for sharing your connection and for joining this call and for joining the fight, I mean, we're all stronger together and we appreciate that. And I see we have Senator Tanya Anderson on the call right now. Would you like to speak? May not be there right now. Okay, we will come back.
Robert, Shay, you want us to jump in and say anything?
Hi, I'm here. Yes.
Thank
you so much for letting me be a part of this tonight. I was thrilled when when Representative Schofield came around selling the capes, because my mother actually has lupus. And so our family has been living with this, I think, going on almost 40 years now. And it amazes me what we still don't know about this disease. And so anything that I can do to assist in this cause, I'm grateful. I'm new to the legislature this year. I was just elected. And so I'm excited to learn about what you all are doing, and please let me know how I can assist as well. Thank you.
Well, thank you. Thank you so much. And thank you for lending your voice and your effort to the fight. We appreciate that. We appreciate it. So we talked about medical marijuana. Here's another one. How do we ensure funding and awareness for lupus? Like diabetes, autism, heart disease, how do we make lupus a public health concern at the state level? I know it's a public health concern nationally. We've seen that. We've seen the white papers on that. How do we do that? How do we continue to do that at the state level?
So I'll just start, and I'd love to hear everybody on this, but one of the ways is that we have to, data drives the needle. So we've got to be able to talk about and really get the numbers of people that are living and impacted by lupus across the state. It just can't be a metro area problem. We know that there are people in rural Georgia, because of the lack of access to specialty physicians and even baseline PCPs, that we've got to get the numbers and the data up to say this is why we need more. And I think things like mechanisms like the Georgia Council on Lupus Education and Awareness open the door to work with organizations such as the Lupus Foundation to find projects that are going to be able to drive us to request more funding to get things done as far as telemedicine, access to more resources. You know, we talked about the school nurses program and how, again, that's been a huge success. Nurses work tirelessly on to make sure that all of the school nurses are getting educated across the state, which is now led into a national transition child-adult transition plan. I mean, we've got so many things that we could be doing well that drive the needle, and we have to stay in front of the face of public health and stay in front of the space of requesting more money. We've got to prove we can spend the money. We're good stewards. The people need it. Developing workplace policies, all of these initiatives are things that can increase funding. But I'll toss it over to my colleagues. How do we get the money? Show me the money, Bonnie.
I'm new at this, but you know, I was just sitting here thinking, and this is not, you know, appropriations, you know, from the state budget, but I think just raising awareness in our communities through maybe Rotary and Kiwanis clubs. I know, I mean, we're asked to speak at those all the time. And I'm thinking that maybe when we do, maybe we just add a little segment about this, since it's personal to us and we're willing to work on legislation that helps people who are affected by lupus. I mean, maybe we should kind of work that in. And maybe, you know, we can do the same thing. We can send our colleagues home with information. You have done an amazing job, Kim, of spreading awareness around the Capitol. And, you know, there are 180 people in that room that go to every corner of the state. And they take that knowledge back with them. And when they hear from a constituent who might have a problem, well, they're going to know what lupus is, and they're going to know it's a serious issue, and they're going to know who to call to get more information and to find out where to find, you know, get resources. So, I mean, that's a powerful, but really free way of kind of spreading the word and the need for advocacy. So, you know, maybe we could get organized and think of something that we can do to just kind of send people home with something, you know.
There you go. I think that's a great idea. And if you're looking for information to send them home with, we've got the information we can provide to you.
Okay.
We've got the documents. We've got the What is Lupus brochures. You know, we've also got a new document on how you can help, how you can get involved. And it just gives people an opportunity to see how they can, you know, what can they do? And I think that's what I found a lot in this pandemic year, is that people are looking for ways to get involved. They're looking for ways to make a difference. Yeah. So Bonnie, that's a great idea. That's a great idea. And I really appreciate that. I appreciate it. So then we've got this next question, and it is, how does the feedback and information you receive from constituents impact how you vote on bills?
Well, it's always helpful for me to hear from my constituents, to know what they think about a bill. So many times constituents have emailed me about a bill that was not on my radar at all, because we really very quickly in the session, we get to a point where we can't read everything that's filed. So constituents will bring issues, you know, to my attention, and I'll go and figure out what it's about. I start by reading the bill, and then usually talking with the author about it. So it's always helpful for me to just know where they are on an issue, to also make me aware of issues and maybe some unintended consequences of some, you know, some well-intentioned legislation. I will tell you what does not help, and which is, I would say, I mean, it's too much, and you all, my colleagues, probably are starting to see this too. We get a lot of form emails from these bot-generated sites, and I can't even hit reply because it's from some bot-generated email address. And a real person went to an advocacy website and put in their information and clicked a button and sent it to me. And my email box will just fill up on an issue. Those do nothing. In fact, what I end up having to do is I have to create a rule in my email to automatically send those to another email box because I can't see the other emails about committee meetings and real personal needs from constituents. So those actually are a hindrance. I love to have personally written emails from my constituents. That is what is most helpful. Or phone calls. It's just hard to find us in our office.
So those form emails aren't good. You have to create, because you just get hit with too many of them. That's really good to know. That's what the third session of our training is going to be about communicating with your legislators and telling a personal story and attaching a picture to that story.
Absolutely.
Let them see who you are and why, how, like what I said in the beginning of the call, let's make lupus visible. How does this affect you? So Bonnie, that is great feedback. So we're going to take some questions from the Q&A.
Terry, can I jump in there for the?
Oh, sure.
I have a little different perspective coming from an advocacy background in the heart of an advocate. I know what it was like when we sit there and we do these emails, even though they're form emails, it's still, if you're not used to advocating and using your voice, it still was something important for me. If I took my time to send a form email to a legislator, I really did expect to get some answers. So I email everyone back. Even if it's a form email, I take the time and I will respond. I try not to do a coined answer. I make everything personalized, and it takes me a lot of work, but that's because I come from the other side of knowing what it was like for me to step up and be courageous enough to put myself out there to do it. It's not, again, it's not anybody else's issue. It's just my personal thing on how I respond to every call and every email that I get.
Yes, and I agree. When a constituent emails me from an address that I can hit reply to, I do. But very oftentimes, and maybe that's something, if someone wants to use those, they should make sure that the site that they're using, it has an email address that they can hit reply to, because oftentimes they don't.
Yeah, sometimes when I hit reply, their personal emails will come up, and I don't care if you're my constituent or not, again, because I know what it was like when we're sitting there and we're trying to do all of this, and they're saying, send these emails out, contact your legislator, and then I didn't get a response. So that's, again, just something that I do because I know that it's important that your voice is being answered. Now, let me be really clear. We get up in the morning time. When I get up and I clear my stuff out every night, in the morning time when I get up, I have already 250 to 400 emails a day, just when I get up in the morning. So if it's a hot issue, as Representative Richard said, or Representative Shea, if it's a hot issue, those emails are going to come like crazy. So, give us some time, and every legislator does things different in different ways. You guys know I'm always going to know what it's like to be on the other side of the ropes.
There you go. Can I ask you something though? And this is just my brain working the way it works. If you get even form emails, if you get 300 form emails, does that show that even if you can't answer them, does it show that that's a hot issue? Mm-hmm. Do the numbers count? Bonnie, does that make a difference or not?
Yes, it does. Absolutely. Mm-hmm.
Okay. But just still, if we want a response from you, it should be something personal. And that's why we're going to work with our advocates on that. We always emphasize that. Tell them about, they need to hear, Bonnie, you're so good talking about your sister. I've seen you on Facebook talking about your sister and the struggles. It's got to be real. Keep it real. Mm-hmm. And let them know what we are going through. So that's great feedback from both of you. So thank you so much. We're going to take some questions from the Q&A. And I think what I'm going to do is, I think Nicholas is sending it to. Okay, here's one. What public health policies and regulations exist now that was answered. What public health policies and regulations exist with respect to diabetes, Alzheimer's, cancer, heart disease that can be applied to lupus? Now, that's a great question.
There's too many to really, it's an unrealistic question. There's just so many health policies that we have that can be applied to lupus. We try to stick to the baseline things that, that again are hot tickets. I'm on the Health and Human Services, and I don't know all of the bills that are coming out. I look at all of the bills and I'll say, well, what can be applied to lupus? Where can we put lupus in here? And anyone that I can stick something on, I always go talk to the bill author and do that. But it's starting these collaborations and these work groups and these other councils that really focus. Dorothy Leona Glasser has done a great job in mobilizing. There are things that she works on that she'll call me, say, hey, we can get lupus under here and this, that, and the other. There's so many ways that it comes.
Right.
We look at public health. We work with Department of Community Health. That's really a loaded questions on. There's no specific piece of legislation except what's going on in each legislative session.
Well, and that's great. You just made a great segue to that. Somebody like Dorothy Leone Glaser, with what she does with her collaborative, bringing together all the different nonprofits. When I spoke with her last night, she was talking about the need to keep us all active in her advocacy alerts and what they do. And that's part of this series. Part of the focus of this series is to take advocacy from being a day at the state capitol to being something that we do year round, and to really get into that habit. So maybe do a series of 3 presentations now, 3 more in the summer, to get people involved where they know that when that alert comes through, that they react and they send something to their legislator and do that, to really engage our lupus community in the advocacy efforts year round out at the Capitol. And we're grateful that you keep bringing those to us. And Dorothy does a great job bringing those issues to us. We're grateful for that. I don't know if Nicholas is on the line with some questions. Maybe Nicholas, you could just ask some of them, because this isn't coming through.
Yeah, I think you all pretty much answered most of them. I know that all that Jazz had her hand raised.
Okay, I don't know.
The other questions are about Medicaid, which I believe you asked. Here's one question. Bonnie mentioned telemedicine. What do we as constituents need to do to ensure telemedicine across the state?
I don't know if that is a provider issue. Fortunately, my sister, where she lives, it is available, but I understand that it's not available everywhere. And of course, the rural areas are the areas that oftentimes have a lack of healthcare. So, I think the market is probably going to take care of that. I think that firms like GoMed are working to actively expand. So I do think that now that we've opened it up to them, I think that you'll probably see the market answer that.
Okay. Now I've got a question. Now that I'm just adding about broadband. We had that down at the bottom, of broadband access to allow telemedicine dental health across the state of Georgia. So how do we do, what kind of work is being done with public-private partnership? And I'll just relate it to a personal experience. Where our office is, we cannot get fast access, internet access, even though we're right in Smyrna and we're a mile and a half from the Braves Stadium.
Wow.
It costs too much to bring it into our building. They want $12,000 to drop a line into our building to give us faster internet access. So that means immediately I thought, then all the people living in that area aren't getting great internet access. They're not getting it for their schools. They're not getting it for their something like telemedicine. They can get it. So we've got internet access, but we're in a suburb that is less than 2 miles from the Atlanta city line, and we're having that issue. What is that issue like when we've got some support groups that can't meet out in Coweta County because they don't have broadband there, and they can't get on Zoom. They get on some of our Zoom calls and they're frozen the entire time. Are there public-private partnerships in the works, or what's in the works for that? Is that a loaded question?
That is a very big issue around the Capitol, broadband. And the Rural Development Caucus is active in that. The providers, there are cable companies. I think, are there EMCs that are also involved in this? They're fighting with each other. I'm not one of the legislators who's actively involved in that and refereeing that. The people who are working in the Rural Development Caucus are, but they are, it seems like every year we have a broadband bill. It's a complicated area because it's very regulated. It's not just a matter of businesses going in and doing what they want. There is a lot of red tape and regulation, which I think, just kind of mucks it up a little bit. But it is something, and every year I think the General Assembly throws money at it in the budget every year. And it became really important this year when our children, in certain parts of the state couldn't attend school. And, there was that one video of those children sitting outside of a Del Taco, I think, doing their schoolwork because they were using the Wi-Fi there. They didn't have it at their home. And so it is something that's very much on the radar, and people are actively working on it.
Good. That's good to know. Like I said, I thought of it in terms of just our office, but then right away with the pandemic, I thought of all the neighbors, all the people that live around us must be having the same issues. Somebody was going to add something, I thought I heard.
Can I jump in? And Gloria Frazier, Representative Gloria Frazier has just joined in again. She's been with us since the very beginning when we were small and growing. So Representative Frazier, if you'd like to say words to us, I'd surely appreciate it.
Yes, good evening, everyone. I had just sent you a little chat in there, giving you a shout out. Kim, it's an honor to join you and Representative Rich this evening as you continue to advocate for our lupus constituents who live with this pre-existing disease every day of their life. I am an advocate for sickle cell, so I know the struggle and the challenges that come with trying to provide the services that our constituents need. I applaud everything that is going on. I am listening to, I'm a little more rural than you are. I'm all the way here in Augusta and Burke County area, and we still doesn't have broadband, and I serve on energy utilities and telecommunications. So I can remember 5 years ago when we were trying to get this huge broadband bill done and found out, I think Representative Rich just said all the cable companies and everybody was fighting with each other about the cost. But we still don't have broadband today, and we still have these services that are needed, especially the telemedicine. So we will continue to fight for those services. We did pass a piece of legislation that's trying to make it a little bit more fair and equitable as it relates to the EMCs and the big companies, because everybody has to stay in business, and we need everybody's support to get this done. Because in the end, it's really about serving our constituents and meeting their needs where they are. And because of COVID, everything has been set back, but the need is still there. So thank you for having this town hall. We had a flood of purple today in the state capitol. You have a true advocate that is there, and she's been there ever since the day she came in the session. And what is it, Kim? 10? Are you 10 years now?
I came in 2008.
Yes.
We started doing this in 2008.
And she's been going strong ever since. I can remember when she came to me and said, "Now, so you're doing this with sickle cell? I want to do this with lupus." And she took off from there, and it's been there every day. Now, you need to understand, you have to have an advocate in the state capitol to make sure the monies are allocated and making sure that lupus is in the forefront, just like I have to do for sickle cell every year. If you don't have anybody there really watching, and it'll get set back, it won't be a priority. But Kim is one of the ones that is in the forefront. And so I applaud you, and thank you for even though we're in COVID, we're having a town hall meeting, a digital advocacy series about lupus. And so will continue to be a part of lupus, just as Kim has always been there with me for sickle cell. Thank you.
Thank you, Representative Frazier, I love you. And then we just have two more. We have Senator Gail Davenport and Representative Sandra G. Scott. Senator Davenport, can you say a few words to us tonight? And thank you for stopping by. We've had four other things going on at the same time tonight. So thank you guys for dropping by. Senator.
Yes.
Thank you so much, Representative Schofield, and thank you, Representative Rich, for all that you do for advocate for lupus, the lupus community. We know how hard it is to get things done, and we know that you need to keep it in front of the community, in front of people, to make sure that they understand lupus and make sure that we have the resources necessary to help. So thank you so much for all that you continue to do for the community. And I still have on my purple here today.
Thank you, Senator. You look so good in your purple today. Thank you.
And thank you for your support. Thank you for supporting the lupus community. We really appreciate you all. If you knew what a shot in the arm it is to the lupus community, to see all those purple capes down there and to see all the work that you're doing and all the work that all of you guys are doing. So thank you so much. And then Kim, you said there was somebody else.
Yeah, one of the big advocates that holds my arms up is Representative Sandra G. Scott. And when it comes to healthcare and everything else, you'll always say to me, what's that gonna do for lupus? So Sandra G. Scott, say some things tonight.
Good afternoon. Representative Sandra G. Scott, represent District 76 out of Clay in Henry County. It is good that I was able to jump on the call tonight. And I would just like to say, Kim is a go-getter and a fighter. I tell you, she's just an amazing woman. She worked hard and she worked extra hard for the her lupus community. And I can say, I be telling her, girl, you need to get some rest. You need to go to bed. She'd be like, I can't, I got work to do. I said, Kim, how much work you have to do tonight? Oh, I have to do something for lupus. So I could tell this lupus community, as Representative Frazier say, you all have a great advocate. You all have the best advocate for lupus. I'm telling you, she really put 120% into this foundation. So I would just like to say, that you all have one of the best, and I'm sure that she will be motivated and stay motivated for the cause. And she knows I can help her or assist her. She knows that I will be there for her. And so again, you all have a great advocate in Kim, and I would like to thank Representative Bonnie for getting on the call with Kim tonight, and you all having this event together to show the bipartisanship and what we all can do for the lupus community. So again, thank you, Kim. Thank you, Bonnie. And thank you to all the people that have joined the call tonight.
Thank you, Representative Scott. And you know, it's true. We are, we're stronger together. We're strong together. And we thank you for all you do. We thank you for the voice that you lend to the cause as well. And we have to agree with you. We're very grateful to have Kim Schofield in our corner. So we are, we are blessed. We keep growing this initiative every year. We started out in 2008, as Kim said. We always say that the first year we went down there, we didn't know what we were doing. We're like, okay, we're here. What do we do? And each year it has evolved and become more and more sophisticated and more specific to the needs of the lupus community. And Kim, thank you for Representative Schofield. Thank you for your direction. Thank you for the direction that we've gotten from our medical advisory board, from our doctors, from the Georgia Council on Lupus Education and Awareness, from our advocacy team. We've got a whole team of about 20 members who help shape the way we put together our advocacy program every year. So this really is a team effort. So I want to just say before we close out tonight, first of all, I want to thank everybody who came on the call. I thought it was terrific information. Does any representatives or senators want to add anything before we close out?
No, I just wanted, there is a comment in the chat about, being discriminated against and the racial and the disparities because we don't look sick and how you get denied. Some of those things are federal issues that we don't address on a state level, although we are all very sensitive to the fact that, you can't get your denied disability, or judges and disability court don't really understand. And no, again, we work with our congressional partners to get some things to change. It doesn't happen overnight. And so everything we do takes a long time. I mean, we are only good, and you've said it again, my colleagues may thank me personally because they see me, but I owe everything to everybody on this call. Without your voice and all of us working together, I'm just the one that y'all pushed up front, but all of you, everybody, the advocacy that you do is so much greater in the space than what anybody knows. So it's not one person, it's a team, and it's your voice are the stronger voices collectively and individually in your prospective community. But all of the things that you're asking about on trying to change a system takes time. And I know, Betty and I used to say, we may not see the changes in our lifetime, but we know right now that we've seen the breadcrumbs being laid and that little things are happening over periods of time. So I know you're frustrated when they don't get it and you can't get the help that you need. Know that we've not given up, we're still fighting. And so I just thank everybody for all that we all do together.
There you go. And there's a saying that true servant leadership is about planting a tree under whose shade you may not see. You may never see the day that shows the shade to you, that grows that big, but you planted that seed. And that's what servant leadership is. And we've got so many great servant leaders on this call, and we appreciate everything that you all do. And we're so grateful. And Kim, thank you. It is a team. It's a team that does it, but it's been the leadership, and you started the leadership for us. So
Thomas started the leadership. It's Thomas. Thomas
starts everything.
Thomas starts everything.
He starts everything. He is the root of every initiative. I swear. Thomas Walters, right? There you go. There you go. It works on that. So when that's a good segue into closing this out. When we talk about disability benefits and that, we are going to have a summit, and it's going to be in May. We're just getting the registration up, and we're getting the speakers right now. One of the sessions is going to be disability and how to approach applying for disability. And there are a lot of ins and outs, and it's always good to listen to the expert and also listen to the changing laws. And we used to have Winnie Pinnell do it every year for us, and every year she had to redo it because of the intricacies of the laws changed, and the requirements, the work requirements, going back to work, the amount of time you had to be sick, the amount of documentation you had to have. So visit our website often, lupusga.org, and we'll have information about the programs that we have. And I want to thank each and every one of you for joining this call tonight. Representative Rich, Representative Schofield, you guys have it's a shot in the arm to all of us. It's a real shot in the arm. And we appreciate your support, and we appreciate everything that you do as we move this needle. This is it. It's forward motion. It's always forward motion. And we couldn't have that forward motion at the Georgia State Capitol without you guys. So we're going to continue to do the work that we do. And I want to tell you just quickly, we're going to do 2 more segments to this advocacy series. Next Wednesday, we are going to have Laura Coburg is going to come on. She is a lobbyist and she's going to talk about how you advocate. You know, she's going to give a lot of specifics. She's a dynamic speaker. We've had her speak to us, to our group several times, and we really look forward to that. Our third segment is going to be about telling your story. That's important. We just came off National Lupus Advocacy Day, which was last Thursday. We had 164 advocates from Georgia call on our representatives. Just absolutely, absolutely incredible. Met with some great representatives, and we didn't want, not senators, but we met with their aides. And it was very productive meetings, just very productive meetings. And one thing that they kept saying over and over and over again is they can learn about the bills. They need to learn about who you are. They need to know who you are and what lupus means to you and how it affects you. We need to get under their skin and let them know what it's like to have a day living with lupus. Share your story. So that's what the third segment is about. So I would like to close this out again by thanking everybody who took the time to join this call tonight. This was an awesome opportunity. We did it during a pandemic. We did all the purple capes down there today during a pandemic. I think we're all pretty awesome. So everybody give yourselves a hand. So thank you for all you do and have a wonderful evening. Somebody's hand is up there. Oh, she was just giving herself a hand. Never mind.
You said give yourself a hand.
I'm sorry. Okay.
Everybody a hand.
There you go. Thank you guys so much.
Thank y'all.